how does robotics change the surgical procedure or the outcome? I don't know.
Yes, it has changed dramatically, because something like if I am operating without robot, think of it. My assistant are my eyes as well. So they will say, sir, ये बराबर है, ये बराबर नहीं हो रहा है. I say, this is good or not. Then it's all hearsay, objective. This subjective, I'll say subjective. We don't have numbers to match. We just feel, and that we see, okay, that's fair enough. So if I cut something in a perpendicular to 90 degrees, I have no clue to understand if it's a 3 degree or 5 degree slope, or it's a aberration of 2-3 degrees. Human eye cannot recognize less than 3 degrees. On a experienced eyes, forget about new eyes. So experienced surgeon can see 3 degree or 4 degree, but not less than that. And now that is a closer. If you have multiple angles in the knee, if you start aberrating on every other angle, you will end up in a bad situation for knee joint. And that's where the knees start failing. So with the robot, what robot does, it gives me a precision in terms of understanding the knee anatomy. It gives me number with the, if you see this knee, the ligaments on the medial and lateral side have the strength like this or like that. So it gives me a number on both sides, medial, lateral, how much is this extension, like full knee, and this is a flexion. So it gives me numbers on both sides. And once I remove this part of cartilage and I have to put the new one, I should get a good balance of these knees, ligaments, to make sure it works beautifully well, like a natural knee. So that balance is done with my brain power, with my understanding and experience, along with the robotics, where it gives me a numbers to understand that, okay, this is the number I have to come to. So I know how much to release, what not to do, what to do, how much to do. So robotic will help me in getting the understanding of a joint much more in a precise manner. So my point of my joint is put in a perfect way, so it doesn't tilt like this or that way, the plate, lower plate, and doesn't cause a loosening. So the life of a joint has to be, it will be prolonging. We have much more accuracy, less pain, and more better function.
So it's basically just a visual system.
It's a visual system which gives me a feedback what I'm doing is right or wrong. So the important part is, in a conventional surgery, if I operate something, I'll only come to know once I see a post-op result.
True.
Without that, all of us are reasonably blind. In a certain we have blind spots. We don't know about it. But here, before I make a cut, if I do certain adjustment on the computer gives me an understanding that if I do this, what is going to be the outcome?
True.
So my outcome is pretty fixed, and I know before I cut it. So it's like almost doing a surgery rehearsal before I cut it. In conventional, we cut and even they see, oh my God, this has happened now.
True.
So here I get all the understanding of how I'm going to cut, what is going to be the option of cutting, what will lead to this because of these cuts and these errors, and what margin should I be doing was certain things. So I think overall it gives me a lot of precision in planning, pre-cut understanding, and again immediate result in front of me once I did surgery.
We use something similar in ophthalmology, sir. It's called our Varion system.
Yeah.
What that does is it is integrated into our microscope. So we can see there is a 3D axis happening in the microscope. It's in the eye. And we can see it is overlapping on the patient's eye.
Yeah.
So it tells us यहाँ पे incision लेने का है. It tells us second incision. Then when we open up the capsule, anterior capsule, it tells us, so it gives us a marker. So we can open it. We are supposed to have the rexus around 5.5 mm. So it basically tells us. And then we align the IOL, especially in toric cases, we have to align it at a particular axis. So it tells us this axis pe hai. And then when we are cleaning out everything, so it tells us if during closing the case, it tells us if there is any retained viscoelastic remaining or not, and then it really helps. It really helps.
It has transformed surgeries now.
True.
There are a lot of robots now. There are autonomous robots which do on their own. We don't use that. We use the Velis, which is the semi-automated, where I have decision power. I do all the decisions, and it's executed by me with the help of robotic saw. Now, what happens is
What is the robotic saw? Excuse me.
A lot of people believe that the robot is going to do surgery. I'm not going to do it. No. Surgical robots are different. General surgical robots are different. They can sit outside and do it. Here we have to go inside. We do all the opening. We do the planning. We cut the bones with a saw. Now the saw has got an array which will be picked up by the camera, and if I change the angle of the saw by a degree or even 0.5 millimeters, it will stop. So the saw will cut in particular precision what I wanted.
The plane will never live. Yeah.
What I wanted has been cut by a saw, and that's been held by me. So I am in total control, and I cannot change what I decided interrupt just because I am doing a wrong thing. So computer picks up that and stops my thing. So that's a robotic assisted surgery. It is not robotic surgery, it's a robotic assisted surgery that is very precise, where my brain and his power of precision comes into play and gives a combined conjugated result which is really good for the patient, because my experience, my knowledge and the precision power of cutting will give us a perfect joint.
I always thought, today my doubt got cleared. Robotic surgery in orthopedics is usually just a visual system that like we use in ophthalmology as well. I thought it is like the Da Vinci system that general
No. That's where I'll tell you a funny incident. A US based person came for his mother's knee, and the system was I just bought. I said we'll do a robotics. He said no, you have to do. I came for only you. We've been coming from 200 kilometers only because of your name, and you are the one who's supposed to be doing that. I didn't tell anything. I said okay, I will do that. I went inside. I did robotic assisted surgery. What I do. Got a perfect result. Next day, I showed him the whole procedure, like what I did, what was the thing, what was the values, what we got in the end. And he was saying, oh, this is the way. Because he was thinking I will be sitting in my chamber, doing something else, and I will just control the robot and someone else will operate. So the understanding of robotic assisted surgery is robot assists surgeon in getting a precision, telling him what is right, what is wrong, and he can predict the outcome before he cuts it. So that's what robotic surgery is.